Welcome back. Let us proceed with our Science and Technology Part 2 Standard 10. The name of the chapter is Disaster Management. We will be dealing with Module 3. I am Miss Jagjeet Kaur. Before starting with Module 3, let us have a recap of what we studied in Module 2. Disaster management is either averting disasters or making arrangement to face it, or at least achieving the abilities to face it. Disaster management is divided into pre-disaster management and post-disaster management. The main aspects of disaster management include preparation, redemption, preparedness, impact of disaster, response, resurgence, and restoration. Let us have a look on learning objectives and keywords of this module. In this module, you all will be learning about first aid, why the training of first aid is essential to all of us, various first aid given to the victims of any disaster, emergency actions taken in first aid during any disaster, and lastly, the objectives of first aid. So before beginning with our module, let me ask you a question. Is it necessary for us to know about first aid? Absolutely yes. So now let us first study why the training of first aid is essential. Everyone should learn at least some basic first aid techniques, as you never know when you might need them. You could be at home, or at work, or at school, or on holiday. Whether it's a minor situation or something more serious. They include accidents, stampede, injuries in fighting, electric shock, burns, heat shock, snake bite, dog bite, fire due to electric short circuit, epidemic of any disease, etc. Victims of such disasters need to be offered some primary help before actual medical treatment is available. It is in such circumstances that first aid is useful. The main objective of first aid is preventing deterioration of health, preventing death, and starting the process of rehabilitation. Also, the person present at the location of the disaster should be able to administer first aid either to himself or to others around him who are in need. Hence, it is essential that everyone gets training of the first aid. So, what is first aid? First aid is assistance given to any person suffering a sudden illness or injury, with care provided to preserve life or to prevent the condition from worsening or to promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available. A first aid is generally performed by someone with basic medical training. Now, let us define first aid. The preliminary treatment given to a person affected by a disaster before actual medical treatment is available in order to prevent death or deterioration of health and to start the process of rehabilitation is known as first aid. Now, let us see the first aid to the victims given of any disaster. Other than arranging for quick medical assistance, following are the list of first aids to be provided to victims of disaster. They are airway, breathing, circulation, bleeding, fracture, burns. So now let us discuss each techniques in detail. So we begin with the first technique, that is airway. The complex structure of the human body leading from the lips to the lungs are often referred to simply as the patient's airway. The airway of the human body is one of the more important parts to be checked when providing first aid and is typically the first item given attention in the seriously sick or injured patient. The airway is the entrance point of oxygen and the exit point of carbon dioxide for the body. Should this become blocked, the victim will have no way to obtain fresh air and death will eventually result. So let us have a look on the procedure followed in airway. If the victim is unconscious and is unresponsive, you need to make sure that his airway is clear of any obstructions. The breath may be faint and shallow. Look, listen, and feel for any signs of breathing. If you determine that the victim is not breathing, then something may be blocking his air passage. The tongue is the most common airway obstruction in an unconscious person. With the victim lying flat on his back, place your hand on his forehead and your other hand under the tip of the chin. Gently tilt the victim's head backward. In this position, the weight of the tongue will force it to shift away from the back of the throat, opening the airway. If the person is still not breathing on his own after the airway has been cleared, you will have to assist him in breathing. Humans breathe by inhaling fresh air into the lungs, exchanging part of the oxygen in it with unneeded carbon dioxide and exhaling the spent air. Blood vessels located in the lungs distribute oxygen throughout the cells of the body. When someone stops breathing, this is a life-threatening condition known as respiratory arrest. Occasionally, when a victim stops breathing, their breathing can restart if stimulated by a rescuer blowing air into their lungs. However, a victim in respiratory arrest is likely to fall into cardiorespiratory arrest, which means that they are no longer breathing and their heart has also stopped. So, with the victim airway clear of any obstructions, gently support his chin so as to keep it lifted up and the head tilted back. Pinch his nose with your fingertips to prevent air from escaping once you begin to ventilate, and place your mouth over the victims, creating a tight seal. As you assess the person in breathing. Keep an eye on his chest. Try not to overinflate the victim's lungs, as this may force air into the stomach, causing him to vomit. If this happens, turn the person's head to the side and sweep any obstructions out of the mouth before proceeding. Give 2 full breaths. Between each breath, allow the victim's lungs to relax. Place your ear near his mouth and listen for air to escape, and watch the chest fall as the victim exhales. If the victim remains unresponsive, that is, no breathing, coughing or moving, then you have to continue with the circulation. The human heart is an electromechanical pump, circulating, nourishing blood throughout the body. If beating stops, the brain, lungs, and even the heart itself stop receiving oxygen. Rescuers can use a technique called chest compressions to squeeze the heart from outside the patient's chest, helping to circulate blood around. In order to determine if the victim's heart is beating, place 2 fingertips on his carotid artery, located in the depression between the windpipe and the neck muscles, and apply slight pressure for several seconds. If there is no pulse, then the victim's heart is not beating and you will have to perform chest compressions. When performing chest compressions, proper hand placement is very important. To locate the correct hand position, place 2 fingers at the sternum, that is the spot where the lower ribs meet. Then put the heel of your other hand next to your fingers. Place one hand on the top of the other and interlace the fingers. Lock your elbows and, using your body's weight, compress the victim's chest. The depth of compressions should be approximately 1.5 to 2 inches. Remember, 2 hands, 2 inches. If you feel or hear slight cracking sound, you may be pressing too hard. Do not become alarmed and do not stop your rescue efforts. Damaged cartilage or cracked ribs are far less serious than a lost life. Simply apply less pressure as you continue compressions. Count aloud as you compress. 15 minutes at the rate of about 3 compressions for every 2 seconds. Finish the cycle by giving the victim 2 breaths. This process should be performed 4 times, 15 compressions and 2 breaths. After which, remember to check the victim's carotid artery for pulse and any signs of consciousness. If there is no pulse, continue performing 15 compressions or 2 breaths, checking for pulse after every 4 cycles until help arrives. If you feel a pulse, that is, the victim's heart is beating, but the victim is still not breathing, rescue breath should be administered. 1 rescue breath every 5 seconds. Over here, remember to pinch the nose to prevent air from escaping. After the first rescue breath, count 5 seconds, and if the victim does not take a breath on his own, give another rescue breath. Generally, bleeding is of a minor nature and includes small cuts, grazes, etc. However, Bleeding may be severe and life-threatening if a large vein or artery has been injured. Some wounds are associated with other injuries beneath the skin. For example, an organ injured by a stabbing, broken bones which have pierced the skin. So, if the victim is bleeding through the wound, then the wound should be covered with an antiseptic pad and pressure by thumb or palm should be applied on it. That means you have to apply direct pressure to the bleeding wound. Then you have to raise the injured area. That is, if the wound is on a limb, raise it in a supported position to reduce blood flow to the injured area. If an arm is injured, you could apply an arm sling or elevation sling. But try to avoid any direct contact with the patient's blood or other body fluids. Use disposable gloves if possible. If gloves are not available, place your hands inside a plastic bag. And if a foreign body is embedded in the wound, do not remove it but apply padding on either side of the object and build it up to avoid pressure on the foreign body. Hold the padding firmly in place with a roller bandage or folded triangular bandage applied in a crisscross method to avoid pressure on the object. And most important, keep the patient at total rest. Even if the injury involves the arm or upper part of the body, the patient should rest in a position of greatest comfort for at least 10 minutes to help control the bleeding. If the wound appears to be minor and the patient is able to travel, arrange an urgent appointment with a local doctor to assess and treat the injury. If blood leaks through the pressure pad and bandage, then you have to apply a second pad over the first. Use a tea towel or similar bulky fabric and apply maximum pressure to the area. For major uncontrolled bleeding, quickly remove the blood-soaked pad and bandage and replace with a fresh bulky pad and bandage. The continuing bleeding may be due to the pad slipping out of position when the first bandage was applied. Broken bones or fractures are a common injury, especially after a fall. No matter what part might be broken or how big or small the injury may seem, all broken bones need medical care. Here's what to do if you or someone you are with might have a broken bone. First, you have to remove clothing from the injured area. Then apply an ice pack wrapped in a cloth. Do not attempt to move or reposition the injured limb. Place a simple splint, if you have one, on the broken area. A splint holds the bone still and protects it until you see a doctor. To make a temporary splint, you can use rulers, batons, or wooden rods and wrap it with an elastic bandage or tape. Get medical care. The injured person should not eat or drink in case surgery is required. Burns are one of the most common injuries. The term burn means more than the burning sensation associated with this injury. Burns are characterized by severe skin damage that causes the affected skin cells to die. Most people can recover from burns without serious health consequences depending on the cause and degree of injury. More serious burns require immediate emergency medical care to prevent complications and death. There are three primary types of burns: first, second, and third degree. Each degree is based on the severity of damage to the skin, with the first degree being the most minor and the third degree being the most severe. So if you come across any victim having burn injuries, it is beneficial to hold the injured part under clean and cold flowing water for at least 10 minutes. Give the victim water to drink. Clean the wounds using a cotton swab soaked in an antiseptic solution. Remember, you should not apply any oily ointments. Cover the wounds using dry dressings. And if the burn is serious, then you have to remove the jewelry, shoes, etc. if easily possible. Do not touch or burst the blister on the skin. Do not try to remove the cloth if it is stuck to the burnt skin. And if the patient is conscious, give water to drink, but avoid tea or coffee or other stimulating drinks. So now let us study the objectives of the first aid. First aid relieves the pain and it also provides comfort and it improves the condition. It gives primary help before medical assistance is available. First aid saves lives. It also prevents deterioration of condition of victims. It protects unconscious victim and the most important, first aid promotes recovery. So students, this was the end of module 3. Now the points to be remembered. The preliminary treatment given to a person affected by a disaster before actual medical treatment is available in order to prevent death or deterioration of health and to start the process of rehabilitation is known as first aid. Other than arranging for quick medical assistance, the first aids to be provided to victims of disasters in the following ways, that is airway, breathing, circulation, bleeding, fracture, burns. So by the end of this module, you have to answer these questions. Why is it essential to get the training of first aid? How can we offer first aid to the victims of any disaster? Following are some pictures of disasters. Which precautions would you take during those disasters? Thank you students. We will be back with module 4 for the same chapter. Till then, goodbye and have a nice day ahead.